Hi, it's Dr. Ali, a cardiologist with 3 decades of clinical experience, continuing my series of lectures for patients. These are for educational purposes only. You should always get clinical advice from your clinician. Today, we're going to cover heart rhythm devices, pacemaker, ICD or AICD, and a leadless pacemaker. First, let's go over what each device does. A permanent pacemaker, it helps when the heartbeat is too slow. An ICD or an AICD, it watches for dangerous fast heart rhythms and treats them with a shock. A leadless pacemaker is a tiny pacemaker about the size of a 4A battery that is placed directly inside the heart. The key question is which device fits a particular patient's rhythm, heart strength, and goals. A permanent pacemaker, it helps when there are symptoms from a slow rhythm. And these symptoms include fainting, dizziness, fatigue, breathlessness, in the absence of any reversible causes, such as a low thyroid or certain medications. Sometimes patients have heart blocks when the electrical signals from the top chamber do not reach the bottom pumping chambers. This is not just a pulse number. The EKG pattern and the symptoms guide the decision. The leads of the pacemaker are usually placed in the right top chamber called the right atrium and the right bottom chamber called the right ventricle. If a needed pacemaker is delayed, the patient may have blackouts, falls, worsened heart failure, or dangerous pauses. When you think of the benefits and risks, a pacemaker keeps the blood flows steady. It does not cure every heart problem, it just cures the electrical problem. The benefits are a steadier heart rate, less likely to faint, and more energy. Risks of placing the pacemaker are about 5% over the life of the pacemaker, including injury to the artery, the vein, the lung, bleeding, bruising, infection, lead dropping, um, and failure of hardware, failure of software, rarely heart injury that's called cardiac tamponade, which might result in death. Overall risk is about 5% over the life of the pacemaker. Pacemakers now last more than 10 years. There's ongoing care needed with device checks and possible future battery change. An ICD or an AICD, it helps when you have a dangerous, fast heart rhythm and it can pace or shock you. It's indicated in patients who have survived cardiac arrest, patients who have sustained ventricular tachycardia or ventricular fibrillation that are dangerous rhythms from the bottom chamber of the heart, patients with a weak heart pump with ejection fraction less than equal to 35% after completing treatment, and patients with inherited or high risk heart conditions. If an indicated ICD is not used, sudden cardiac death may remain high and the patient could die suddenly. Benefits and risks of an ICD: it monitors the heart rhythm 24/7, treats VTAC, VF, and bradycardia. Benefits are rapid treatment in seconds, lowers sudden death risk. Many ICDs are also pacemakers. Risks include the same as that of a pacemaker: infection, bleeding, lead or lung problems. In addition, it may shock when not needed and cause pain and anxiety because of this. You still need to take medications and still need follow up and a shock plan. Finally, the intracardiac pacemaker, it's a tiny pacemaker inside the heart. It's placed through the leg vein. There's no chest pocket, there's no chest incision, no long lead, there's no possibility of pocket or lead complications. The complications in this case are groin, bleeding or bruising, rarely heart puncture, or fluid around the heart and device movement. It's not indicated for every heart rhythm. It's mainly for slow heart rhythms. Thanks for watching. More to